you. Apologies for absence. We've got Prue, George, Susan and Andrew. Is that everyone? Thank you. Declaration of interest. Have we got any declarations of interest? Doesn't look like it. Right, thank you. As far as I know, there's no public questions, no town and parish council questions, and no councillor questions. So we're going on to Wokingham Borough Pharmaceutical Needs Assessment, and I believe Karen's doing this. She isn't there. Pardon? Oh, sorry, yes. Got to approve the minutes. It doesn't say that. We've got to approve the minutes anyway. So that seems to have been missed out. Oh, that's why I jumped over it too soon. My fault. Any problems with the minutes on page 7, 8, 9, 10, 11 and 12? Okay, can I propose that we approve the minutes? Have I got a seconder? Stephen, all those in favour? Okay, thank you very much. So now we go on to, because I've done all the question times, pharmaceutical needs. Is Karen here?
I'm here.
So,
thank you, David.
Okay, thank you very much.
Thank you, Chair. So the first item yet is the pharmaceutical needs assessment, and so today we are here asking that you approve the pharmaceutical needs assessment. So this has been developed by partners across Wokingham, including our statutory representations and input from the ICB primarily. As a reminder, the Health and Wellbeing Board have a statutory duty to complete a pharmaceutical needs assessment every 3 years, and the duty is the production of the needs assessment. So any work that comes out of it, any changes to pharmacy numbers or what is provided is for other partners, namely the ICB, to take that forward. So it's purely looking at the need in our borough. I'm going to hand over to Soar Beyond, who were commissioned by Public Health to lead on the P&A, and I'll let them introduce themselves and the key findings from the P&A.
Thank you. Hi all, I'm Angela Sharma. I'm CEO at Soar Beyond, a company that supports pharmaceutical needs assessments across the country. We've been supporting with the Wokingham Borough Council needs assessment as well. I know the paper's been submitted, and as Karen said, it's a statutory responsibility to ensure that this is published ahead of the deadline, and we're looking for approval of the documents submitted. I guess as an overarching thing, the key part of the P&A and the P&A development is ensuring that we've got a clear process in place and ensuring that that process has been followed as part of that, and that's been kind of overseen by a local project group as well as Bob ICB in terms of the membership there as well, to ensure that we follow regulation as well as then ensuring we've got the right stakeholders around the table to ensure that we're getting the right conclusions and narrative across the document. So the key findings in terms of the P&A, and again, the detail is provided in the paper, is very much around that there is adequate services across the borough. There are 20 community pharmacies across the borough, and although this is a low number when you're comparing it in terms of a 100,000 population figure, it has still been assessed in terms of it being adequate in terms of service provision across the area. In terms of, there's been a slight change in number, however, that's very much in terms of a reduction in 1 since the last P&A, but that's actually a postcode allocation. It was allocated within Wokingham when it should have been actually allocated within Reading's P&A. So physically, there's been no change. So it is the same in terms of provision last time, where no gap was identified in terms of service provision, and that's what's been concluded in this P&A as well. It has been out to a formal consultation as well. That consultation involves statutory consultees which included LPC, LMC, neighbouring health and wellbeing boards, as well as then the ICB and the commissioning team as well. And it also included members of the public. Again, from that consultation, which was also made in accessible format on request, nothing came back to kind of to be reviewed to change the conclusions. So following consultation, it has been agreed in terms of the P&A is fit for purpose and ready for publishing, and with the Health and Wellbeing Board then to approve. Any questions, I think, more than anything else? I know it's a lengthy document, but that is governed by process in terms of making sure that we've covered all the aspects of all the health needs across the area, as well as mapping out the provision of the pharmaceutical service provision across the area.
Stephen.
Thank you very much for the presentation and for highlighting some of the key features. I'm still kind of trying to grapple in my mind with the figures about the number of pharmacies per 100,000 of the population. We're one of the lowest in England, and yet it's stated that we have an adequate supply, and I find this quite difficult to get my head around. We've experienced a 15% growth in our population in the last few years, and yet that doesn't seem to be reflected in the number of pharmacies. Is there anything you can say that might give me some reassurance?
Yes, certainly, and I'll probably bring in David from the LPC as well to kind of support in terms of the conclusions. So in terms of the number per population, it is a capacity conversation in terms of how busy a pharmacy may get. But in terms of what was assessed in terms of across the provision, it also noted the dispensing GP practices across the area. So there is provision within Wokingham, but it also was around the availability via transport and how many people could get to a pharmacy within an allocated time. There's a national kind of, I'd say it's an unwritten rule, because it is an unwritten rule in terms of being able to get to a pharmacy within 20 minutes based on the previously written article. And that's kind of what guides a lot of people. And based on various methods of transport, whether it was walking, public transport or by car, individuals were able to travel to a pharmacy within reasonable times. And 90% of the residents through the mapping could walk to a pharmacy within 30 minutes, with 100% via public transport within 20 minutes. So utilising all those aspects, as well as then also considering the different various methods of accessing medicines now, because there are distance selling pharmacies that are also available that provide mail order. For those that do struggle with access, there are alternate provisions, and although not a commissioned service, a lot of community pharmacies will deliver based on need. It may be a paid for service, but it is kind of part of, if a need exists, there is provision across the area. I'm going to ask David to come in terms of possibly some of the commercial viability aspects of all of this as well, to kind of add to why we've considered there being no gap, although capacity and some of the comments that might have come through in terms of how busy a community pharmacy might be, because that's what we're saying, is based on current community pharmacy contracts and viability.
Yes, thank you for that. The landscape of pharmacy has changed somewhat the last 5 years, and you're correct to note that the total number of pharmacies nationally is diminished by some 15–20%. And quite correctly, you've pointed out that the population of Wokingham is increasing. More patients, though, do choose to send their prescriptions to online providers. And I'm talking about the very large ones like Pharmacy to You and Boots. And obviously that is for those people that are digitally numerate and literate, and it suits their lifestyle. Doesn't suit everybody. But pharmacies now are changing the way they work, and the actual dispensing of items is now done much differently than it was 5 years ago. Technology is now being used to free up the pharmacist's time to do less of the physical checking labels and sticking them on boxes. They do more clinical checks now using the IT that's there, and that frees them up now to do far more services. So we're doing now things like Pharmacy First, the contraception service, blood pressure checking, new medicine services. And these are all appropriate in the way that the funding has changed as well in pharmacy. So you've got 20 pharmacies in Wokingham. Their 20 pharmacies are in a much more financially precarious position than they were 5 years ago. But now some of the bigger players have moved out of the market, like Lloyd's Pharmacy went completely. Boots have divested a couple of pharmacies. The ones that are left tend to be owned by independently financed pharmacists or smaller family groups, and they're far more committed and bought into the local community, far more engaged. And I would say it's almost less is more in this case. If we start introducing new players to the market, that will sort of disrupt what's there now and actually threaten the long-term viability of pharmacy. So bear with us. Things aren't always rosy. I know that. We look sometimes at some pharmacies where they've got, slightly longer queues than there should be, but some of that might be external factors because the pressure on GP practices has increased. And one of the biggest issues we have, which is a national issue, is supply chain. Getting hold of medication is really difficult for some illnesses, and pharmacies are spending a day a week just locating stock. And we know there's been some disruption recently with weight loss medication. The government's working hard trying to get big pharma to play ball and to continue to fund the UK at the lowest possible price, but there's some international disruption to that. So locally, though, which is why we're here today, I would suggest that, yes, geographically, there is the right number of pharmacies in Wokingham. Sometimes doesn't appear that way with local issues, but we do work well with our local ICB and Public Health and Health Watch to try to address those issues as they come along. And, I can see if we can sustain what we've got now, a good future for providing healthcare at a local level. In fact, we could do a lot more in terms of providing services.
Thank you. Is that okay, Stephen? Thank you. Ben.
Thank you. I just had a question about sort of out of hours provision, really. So evenings and weekends, and I was looking at the figures and it seemed quite good. And I just wonder if you could comment on how that compares with.
Well, that's diminished everywhere. Several years ago, exemption was brought to the marketplace. If you promised to open 100 hours a week, you could have a pharmacy without any market entry. And this brought in some of the out-of-town supermarkets, Boots, etc. That's now gone. And in fact, the existing 100-hour contracts only have to open 72. And alongside that, the standard NHS contract is only 40 hours. The majority open 50-something. But again, due to financial pressures, opening hours has reduced on the whole across the country and in Wokingham. But it is within the remit of the ICB, if there was demand there, that they could commission longer hours in certain areas. So that's a conversation we do have quite regularly with the ICB to identify any potential need for longer opening hours. But happy to have that conversation going forward.
Thank you. You said about financial constraints, and certainly I've heard that some medicines, pharmacies, in fact, have to pay more for it than they get back, things like that. And certainly it seems that pharmacies are not well done by at the moment. Is that going to change? Is the government going to do anything?
Yeah, so we had a 5-year contract going back from 2017, which was flat. There was no increase year on year for 5 years. We then started negotiating with the older government about a new contract, but there was a change, so that there was a delay on a new contract. So the current government then agreed a short-term sticking plaster really to the current funding, but from I think next month into November, Community Pharmacy England, who is our national negotiating body, are going to start talking to the current government about potentially a better contract. We've got our fingers crossed, but we do know from a recent survey by the National Pharmacists Association that 51% of pharmacies currently don't make any money. So we need to make sure that any new contract and local commission contracts sustain our local pharmacies, or more will go.
and that's the fear, that more will go because it doesn't pay.
Correct.
Thank you. Okay, I think that's everyone. There's no one online with questions. We've got to adopt this. So can I propose that we adopt it? Have I got a seconder? Stephen, all those in favour? Okay, thank you very much. So you can now take that away. So thank you. Okay, then the next item is Eat Well, Be Active Needs Assessment. I believe this is Karen again.
It is, yes. Thank you, Chair. So this is the Eat Well, Be Active needs assessment that we've brought here for the board to approve, so that can go onto the observatory and be public to inform local service provision, policy strategies locally. So this is about food, this is about weight, this is about our physically active environment in Wokingham. So the aim of the assessment was to show the weight profile of children and adults, to show current data on food, nutrition and food systems, to show the levels of physical activity of children and adults, and use data to help describe the populations within the borough who have that unfair disadvantage when it comes to eating well, being active and being a healthy weight. And as I say, we're going to use those priorities and recommendations to take forward work. The first priority will be the physical activity strategy, and going forward we'll be defining our weight management pathways for children and adults and looking at the food future going forward. In, again, another lengthy document to read through, 61 kind of clearly defines the kind of summary outcomes from the findings that I'll just read through for everyone's awareness now. So the number of children with obesity doubles between reception and year 6 in Wokingham, and we see that this is significantly higher average of obesity in children in our most deprived neighbourhoods in Wokingham. Obesity is twice as common in children with learning disabilities in comparison to those without, and in Wokingham there is a 15% increase in the number of adults overweight in the past kind of 5 years, and that trajectory continues. Obesity prevalence increases from 1 in 4 to 1 in 3 in the most deprived wards, and we see a similar pattern in adults with learning disability, where obesity is 38% compared to 33% in the general population. In terms of physical activity, 42% of our children and young people are physically active in Wokingham, which is lower than the England average of 48%. When we try to look at the inequalities that might exist beyond the average within that, with the number of responses to the national survey was too low, so we weren't able to do that. So that's something we'd look to do going forwards, encourage that participation. But that's hard in a borough like Wokingham because of our population size being smaller than other areas. 68% of adults are physically active, meeting the Chief Medical Office guidelines for physical activity, and that is higher than the national average, so it's higher for adults but lower for children. But we do still have 18% of our adults are inactive. There is a gender divide, so 18% fewer females in Wokingham meet the national guidelines for physical activity, and we see the same pattern in kind of strengthening muscle activities as well. And physical activity levels decline with age, so older adults are less likely to feel they have the opportunity or ability to be physically active. For food and nutrition, there was 3 key findings. I mean, there's lots in there, but to summarise for the board tonight, the number of children eligible for free school meals has nearly doubled from 6% to 9%, just over 9%, between 2014-15 and 22-23. Nearly a quarter of Healthy Start eligible families have missed out on the offer in Wokingham, and the number of food bank meals distributed to families has nearly trebled for adults and more than doubled for children in recent years. So as a reminder, it's the Physically Active Communities Action Group who has led on this joint strategic needs assessment, who are obviously key in delivering the Health and Wellbeing Board strategy into action, and they will lead on taking forward the recommendations. So Joe Howarth is on annual leave today. So it really is your approval today that we're seeking to be able to publish that onto the observatory, and I guess your continued support in terms of taking that work forward.
Thank you very much, and thank you for all the work. And certainly, there's an awful lot in here, and I know on the first reading of it and the second reading of it, I still don't, I still can't get half of it. There is an awful lot of information here I was just worried, well, yes, perturbed that in Hawkden, age 11 kids have a second worst for obesity in the borough. And I think, well, what can we do about that? And what does this piece of work, which is very important, how can we translate it into real action? Because that's what needs to come from something like this.
Mm-hmm. Yeah, I completely agree. So we've got our physical activity strategy workshop, first stakeholder workshop happening on the 9th of October. I think nearly everyone in this room has been invited, and I'd encourage and you'd be very welcome to attend. If you feel you haven't got that invitation, please reach out to me and I can send that to you. I think that's what we are trying to do, is, in Wokingham, is to think about those building blocks to health and wellbeing, which is embedded in that report as well. So really thinking about a whole system approach to how we live and be active and be healthy as part of everyday lifestyle. So we'll be looking at the active environments, looking at active structures and systems, such as our schools, such as our hospitals, such as our leisure sites. How do we make that accessible, inclusive for all? So it really is thinking about systems and structures and environments to support people to be active as part of everyday life, and therefore hopefully be a healthier weight, rather than that more clinical traditional NHS lens that we've had in the past. And that's based on more recent research.
Thank you. Stephen's got a question.
Well, it's not so much a question, Karen, as a comment really about how much of this does connect with the Marmot agenda, which is obviously something that the council has embraced and is working on. Here we've got two of the, I suppose, key building blocks to healthy lives and general well-being: diet and exercise. But obviously there are other building blocks too that this report is not considering, like good quality housing, access to education. These are all vital as well. And what it underlines to me is, perhaps in that first bullet point on page 138, where the findings are summarised, is the really intimate connection between inequality and health inequality. It's no great surprise, I guess, that obesity problems are most prevalent in those areas of the community with the least money. And that is our big challenge, isn't it? That trying to get a change in lifestyle for people with very limited means to live healthily. And I think that's the big challenge.
Yeah, I'm pleased you recognise it as being a big challenge, and I think it's a challenge or a way that we can only see progress and success by working together as a system and seeing that as a priority. So we absolutely have considered the building blocks. This work kind of started before that kind of building blocks language and Marmot language was kind of part of the council, but it's very much embedded into that thinking. So absolutely children in early years in terms of that best start in life will be a priority. Absolutely thinking about inequalities as part of that and beyond the average will be key. So transport, you'll see kind of active travel as part of that. As you say, the food building blocks in there. The first workshop event on the 9th of October, I'll be co-chairing it along with Nick Irvine in the council, who leads for planning and economy and culture. And I think kind of showing that joint co-ownership straight away in terms of this being about place and building blocks. But of course, we'll be encouraged by having children's colleagues and others there helping to shape that work as well.
Thank you. Rachel, and then Rebecca. Sorry.
Don't worry. It happens a lot.
Rebecca.
What are we doing to reach out with our partners to do with adults and children with learning disabilities that are overweight and obese? It is a known problem. It's nothing new, but what are we doing?
Yeah, so we have done focused work with CLASP in particular to think about how we can support and train staff. So again, it becomes part of their culture and everyday. But part of that weight management pathway, I guess, is what do we need to do for those groups who really need it? And I think a priority for us will be thinking about that, but those with learning disabilities. So they are invited along, again, to help shape that thinking. And so we can think about how we can improve that for them. So there is work happening, but obviously, yeah, clearly more needs to be done too.
Thank you. Nick?
Thanks, David. Thanks, Karen, as well for the presentation. There's a huge amount of data. I think the physical activity strategy is going to be really key to making any difference to these numbers, and I would really strongly encourage partners from the health and medical sector, particularly practitioners, to get involved in the development of that strategy, because I think that's critical, because a lot of the people that are most affected by obesity and ill health have come across doctors' desks, if you like, GPs and so on. So I'd really like to encourage their participation in that, and well, also schools strongly as well, because there's a huge opportunity, I think, within schools to improve activity that seems to have slipped down the agenda over many years, and also clubs, sports clubs, private sector providers as well, because I think there's a danger in focusing on the smaller numbers of people who are more seriously overweight, that we miss the bigger picture, and by targeting those small areas we may actually miss the opportunities for the whole nation, because overall trends are downwards in terms of health and well-being. Inactivity is increasing, overweight and obesity is increasing, and I think we should be doing something for the mass market as well as for the minorities who are struggling more so.
Yeah, and I think I can see Jyoti, the DPH wants to come in, but I agree. And in a way, almost by bringing the whole curve down in that proportionate universal approach, which, you know, Marmot does as part of his, is that. So we have to make it a whole system change. And with that whole system change, we shift everyone down that weight agenda and into that more active agenda. So absolutely support your thoughts, Nick.
Yes, thank you, Nick, because that's very true, that if we concentrate on the people who really need help, the others get forgotten and will really need help in time, whereas if we work with them early, it's far better and far more productive, so that's good. Jyoti, sorry.
Yeah, I just wanted to support what Nick said. I think that obesity is now not a targeting issue, actually. It's a population issue, with about 65% of our adults overweight and about a third of our children now overweight or obese. And we have to look at universal plus targeted measures if we're going to address this issue. I also want to comment on the two-way relationship between one particular building block, education, and physical activity and diet. Good physical activity and diet, there is a strong evidence base that they impact on good educational attainment. And also education, I think someone else pointed it out, is a really good platform to get a universal reach in a way that is not stigmatizing, you know, getting kids active as part of the school day, looking at school food, nutrition, etc. I think are really good ways of starting to tackle this issue.
Thank you, Jyoti. Has anyone got any more questions? Karen, do you want us to adopt this so that you can?
Yes, please. If you could approve the needs assessment so we can publish it on the observatory.
Okay. So may I propose that we approve this needs assessment?
David, sorry, Councillor Hare, may I just come in for a second?
Sorry.
We did come to the board a while ago with a programme of official JSNA topics. This was started before we brought that paper here, and so it wasn't set up as a JSNA, but we would really appreciate it if the board could adopt it now as a formal joint strategic needs assessment. Thank you.
So may I propose it's a form of joint strategic needs assessment? And I think Stephen will second it. Okay. All those in favour? Thank you very much. Okay, thank you.
Thank you.
So now we've got the helping early strategy, which in some ways is something with obesity too. If we can help early, we can stop it. But there's helping early strategy, and I think is that Estelle?
It is, yes. Hello, thank you. Yes, sorry, I'm just going to find it on my screen. So yeah, I'm here to present the helping early strategy, and I think as you as you have quite rightly already pointed out, the kind of links and synergy, I guess, with what Karen has just been talking about, and the marmot building blocks, the health and wellbeing strategy, wider strategy, it very much aligns with. So the Helping Early strategy is really aiming to enable the whole ecosystem, if you like, that provides support for children and families to move away from early help being understood and seen as just one service or team that belongs to the council, or indeed as a kind of confusing maze of pathways that have to be accessed by moving through different doorways, the different thresholds, some of which mean you sit on a waiting list to get what you need. So the Helping Early strategy is really reframing that and is about addressing the inequalities that some groups of children and families experience, and helping families much earlier. I think you know, in Wokingham over the years we have reduced the early help activity, if you like, and we've seen an expansion of children and families needing statutory services, so having that kind of presenting with a higher level of need, and so we really are looking to offer that help much earlier, and doing that together with our partners. The strategy is very much developed with partners, been co-designed with voluntary and community sector and with practitioners, very much with family voice and children's experience at its heart. It included focus groups with families, and also a lot of sort of auditing work in that early help space, and really using family stories really to in its design. At the kind of heart of the delivery, really, we are looking at family hubs. And so that very much being around offering place-based support for children and families, where so really improving families' access to services where they live, and offering and really looking at that kind of best start in life strategy as well, the links with that, that working with families to improve that kind of home learning environment, and making sure that everyone can access the services and opportunities really that they need early in life. Is there anything else? I guess it's sort of asking if people have got questions around that. I mean, the priorities are very much around offering a much broader parent support from those family hubs, improving the digital offer, which we already have started to do, but there's always more improvements that we can make to that, and just generally having a much more joined up system for the all of those services and organisations out there that are providing help and support already, and making it just much easier for children and families to navigate.
Thank you very much, Estelle. Some other questions? Rebecca.
Just something I wanted to raise, because it's something I have discussed with Jyoti as well, about the fact that we're failing on our KPIs. We're in red for our visits with newborns. We're not meeting targets. And I know Jyoti's looking at the contract there, but you know, this is all about helping early. So how does that marry together? Because when we're not actually doing that well at it at the moment, we're missing. We could be missing those people that picking up on them that really do need our early help, and they get into, so they're into this system. But if we're not picking them up right at the beginning, how is this all going to marry together?
So we're working really closely with, oh, Emma's got her hand up, so she might want to answer this. I might leave this one for Emma, actually.
We've got Emma and Jyoti, so you fight out which one's first. Emma, come first, and then
Jyoti, do you want to talk about the contracting and
so yes, we've been working really closely with the service providers to address this issue. It's not acceptable. We do want them to absolutely improve on both their antenatal visits, because that's the first step in building that relationship with parents to be, and to address subjects like breastfeeding at an early stage where it's early enough to make a difference. And then that newborn visit, as you say, I think seeing someone in their own home really does give you a lot more information than a telephone call, etc. And a lot of our counterparts in other areas are counting telephone calls as a visit. We haven't. It's not good enough. We all recognise, including the service provider, it's not good enough. We're taking a three-pronged approach to trying to improve performance. One is looking at workforce configuration. There is a national shortage of specialist health visitors, but we're working with them to get to the optimal configuration of workforce so that we can maximise uptake of those checks. Communication, so even when an offer is made for the antenatal visit to parents, they're not taking it up. So we're looking at how we can make that offer in a better way to increase take up. And thirdly, looking at data. So at the moment, there is an issue with notification of pregnancies for that antenatal visit that we're working with the service to address. It looks like there's a particular issue in Wokingham with midwives not pressing a particular button or making a particular record, which we're working with them to address.
thank you, Jyoti. You got anything to add to that, Emma?
just that as Jyoti has indicated, we're very aware, and thank you to Councillor Margetts for raising that question, because I think it gives us also the opportunity to talk about the work that we are doing as part of the strategy, which is exactly that, understanding where we've got gaps in service, how we can pull services together, and that will be a key part of our delivery plan in relation to the rollout of family hubs, and making sure that we've got a much more joined up offer, using our own practitioners working alongside health visitors, to kind of shore up the offer for families. I think it's fair to say, and has been highlighted in the previous report, pressures and challenges have been building for some time for children and families in the Wokingham Borough. Some of that is linked to increases in population size, but I think some of that is linked to some of the national pressures that are acknowledged that have been on families, and particularly larger families that we're aware of. And last night we had our Children's Overview and Scrutiny Committee, where we were looking at some of the increases that we've seen in demand for statutory services. So there are some real opportunities here for us to come together differently, to look at the neighbourhood agenda alongside NHS colleagues, to look at the Families First programme, and the rollout of the Best Start in Life family hubs, to really come together as multi-agency teams to support in the delivery, so that we can ensure that there aren't any families and children falling through gaps in Wokingham.
Thank you. So, has anyone else got any questions? Don't think so. So, do we just accept this, or do we just to note? Okay, thank you very much. And then we move on to the Wokingham Borough Health and Wellbeing Board and review. Is this Jyoti or Deborah?
It's me again, and
Oh,
Deborah will
it's
come in
you.
and support.
Sorry.
Become the Karen show this evening, so thank you. Let me get the next page. So this relates to the Health and Wellbeing Board annual report. And so you may remember we've been talking about at this board previously that we were aiming to work to more of an outcome-focused annual report and creating a dashboard. So there's a lot of work that's been going on for the past 18 months to create this new dashboard format. We've been working with all the chairs of the 9 partnership groups who are who lead on the delivery of the Health and Wellbeing Board strategy into action. And we'd hope that those, and they will, that the chairs of those groups will use this new dashboard format to give more detailed narrative when they come and present at the steering group. So we're seeking approval of the Health and Wellbeing Board annual report and noting that the detail will be discussed by chairs as they present going forward. So again, it's a lengthy document that has aimed to summarise the work and the forward plans of all 9 Health and Wellbeing Board partnerships, as well as their broader ambitions against the wellbeing strategy and the strategy into action. The dashboard contains a number of indicators against each priority area in the Health and Wellbeing Board strategy. And as I say, the chairs of those 9 partnership groups are responsible for setting the indicators, providing the commentary, and driving the action and the activity. And each page sets out why the indicator is important, and where possible, we have used data that is publicly available, because this will be published in the public domain, and that helps with the validation and also against benchmarking to other areas in England. This can obviously mean in that sense that, as you know, published data, there can be delays, and sometimes the data outcome can seem far from what the groups are actually doing on the ground in terms of that action activity, in terms of working towards longer term outcomes, which often you'll see there is overlap between the partnerships, and often it's held by one, but actually there's a common narrative against all of the groups working, or a number of the groups working against an outcome. The Marmot principles and the building blocks, and try to reflect those that most strongly align. Sometimes, again, there'll be more, but it's really linking it back to the most pertinent Marmot principles and building blocks. It's got circulated as a PDF, but it will be an interactive Power BI dashboard that will get published. And Deborah, our colleague in the Public Health team, will just give a short demonstration of how to use it, I guess, so that everyone's a bit familiar. But we can obviously provide further support where needed. So Deborah, if I hand over to you to kind of talk us through an indicator.
Thank you, Karen. I've just shared my screen, so hopefully that you can see that. So in terms of the Health and Wellbeing dashboard, each page has these 2 navigation buttons on the top right. So you have the option to navigate via the priority area or the partnership, depending on who you are or who your audience is. So if you just click on the buttons, so I've chosen the priority areas, and you can see the 6 priority areas listed here. And against the highlighted ones, you can see the indicators associated with that priority area with a snapshot, the latest data for each indicator. So if you click on a different priority area, you can see a different combination of indicators shown. So I'm just going to take this one, early years foundation stage, good level of development, which is saying it's 75.5% for Wokingham. I click on it and it opens up a detailed page. So under each of the 37 indicators, we have a page that looks exactly like this. Lots of information on it. So on the top left, we've got the rationale why we've chosen that indicator. We've got the priority area, the partnership group, and the Marmot principle. You can then see we've got the building blocks of health and wellbeing, and the last one has been highlighted with an orange circle, and that's because that's the education building block, and that's what the building block that's associated with this indicator. On the left hand side, we've got a trend over time chart, which is benchmarks against England and the South East, where that data is available. In the hover over button here, there's a bit more information, and where it's available, we've got statistical significance against England. We've then got a bubble chart on the bottom, and this hones in on the latest data available for Wokingham. So you can see Wokingham Borough Council again here, 75.5%. And then we're drilling into various cohorts that are associated with this indicator. So if we choose to look at the females, we can see the good level of development for the latest year is 82%, but we compare that with the males, which is 70% for Wokingham. The cohorts along the bottom will vary depending on the indicator. So, for example, if we're looking at a smoking indicator, we'd be looking at socioeconomic groups, routine manual workers. And then finally, on the right-hand side, we've got narrative provided by the partnerships under 3 headings. So we've got the top successes for 24-25, top opportunities for the coming year, and finally, the current and future challenges. And then in terms of navigation, if you want to then step to the next indicator, you can just return to your priority area and then choose your next indicator. And that's it. Thank you.
Thank you very much, Deborah. Got anything more to say, Karen, or should we ask for questions?
Yeah, happy to take questions. Yeah, thank you.
I mean, again, thank you all very much, whoever's been doing this. It's a very, very concise and useful document. There's almost too much information in it sometimes, I think, but you know, that's good rather than bad. But there is an awful lot of information in this. And I personally ask again, how are we going to work with this? We've found these facts and so on. We've found out where we need to improve and things like that. How are we going to do that in the area in the next year?
I think the key thing about using the dashboard is, you say, there's a lot of information and we haven't gone into the detail today. So I think we've obviously got the steering group meeting coming up in October, where we've encouraged all the chairs of those 4 partnership groups presenting to use this dashboard, to use the narrative and any updates in it to go through that detail for those outcomes that they own. And I think it's only by looking at the outcomes and tracking the activity and seeing if there's improvements, if there's not improvements, better understanding the beyond the average detail behind that. So you might see an improvement overall, but who's missing and where do we need to focus our attention? So I think really it's about proving it today, but using it as a tool to encourage activity and system working going forward, driven by those outcomes and the data.
Yeah, it's encouraging activity, and it's also looking at how we can work together in some ways, because sometimes things, you know, they're two different things you're measuring, but there is a correlation between them, and so how we can work together in that way too.
Yeah, agree.
Any questions? Stephen?
I suppose, you know, good data is the basis of good policy and good practice. So having good data is vital, and there's a lot of data there, all potentially very valuable, I think. But are there any bits of the data that you have concerns about? Any bits that you're less confident of as compared with others?
So I can only speak on behalf of guests in terms of working with partnerships and the feedback we've got. I think the one reflecting back on working with colleagues is the self-harm statistic, which feels very much at the top end in terms of the hospital episode statistics of people presenting with self-harm, and how that relates back to, as I say, our work in a local government. But I think only by investing in our children and young people's mental health, resilience, their ability to thrive and to cope, actually that is the outcome, I guess, if we don't put that resource into prevention, into our children, young people collectively as a system. So this is a first draft, and I think all partnership leads, although they put the indicators out at the start and agreed, I think they've all reflected on how this could be better. I think we're always striving to be better. I think that's a good thing. And I think the beyond the average bit is also doesn't exist for all of the outcome indicators at the moment. And so there is work to think about how we can find beyond the average for those indicators that didn't have it. Deborah, I don't know if you have any other reflections.
I suppose that's what I was trying to get at, really, the extent to which we've got a good on the average picture, but when you look under the bonnet, you find there's enormous variation, and identifying where that variation is and where the particular problem areas are isn't always very easy on the basis of average figures. So it's how much we can excavate down, and we clearly can do it in some of those areas, but rather less effectively perhaps in others.
Yeah.
Yes, and I think that's also, you know, a lot of what Marmot's doing, finding out the areas where you know, the average is hiding the reality, and that's, you know, not easy always to find, and people often don't like that, but that's finding the truth, and that's so important. Okay, any other questions? I don't think so, so we'll move on to the ICB briefing, and that's Ben.
Thank you very much. Yes, so I've included a report in the papers. I'll just talk through a few highlights. So big news for us in the ICB was the government announcing to Parliament on the 9th of September that Frimley and Bob ICBs will come together from 1st of April next year into the new Thames Valley Integrated Care Board. So that will serve 2.5 million people across Buckinghamshire, Oxfordshire and all of Berkshire, including Wokingham Borough. This was very welcome news to us, as it gave us a clear way forward and was the first sort of formal confirmation of the timeline, and that allows us to move forward. It's part of the national programme to make ICBs more strategic and more population health focused. So I think a lot of the themes we've discussed tonight around weight management, activity and so on will become real ICB areas of focus in the new ICB. Following the announcements, the senior leadership arrangements are starting to be confirmed now. So Dr. Priya Singh's been confirmed as the chair designate of the new Thames Valley ICB, but as of today, she's the only confirmed appointment so far. So we're starting there and working, but hopefully over the coming weeks, that will now progress. We've also completed some initial development work and design work on the new ICB, including engagement with staff and partners, including the local trusts, local primary care leadership, Health Watch and local authority partners, including Wokingham Borough Council. We've had a lot of letters and documents from stakeholders sharing their view on how they think that the new ICB should develop as well. This work's ongoing, still in early stages really, and we'll continue to provide regular updates. It will have to move at pace over the next 6 months in order to get ready for April, of course. Moving on to wider system matters, the last round of resident doctors' industrial action in July did actually have a reduced impact compared to the strikes last year. So there was less disruption, with the NHS able to maintain 93% of planned care and treat around 10,000 more patients nationally than during the previous strikes. So that was a positive from a patient point of view, at least. We've also been working at a pace with local partners to secure a new provider, Millbrook Healthcare, as the new community equipment provider, after news that the previous supplier, NRS Healthcare, went into liquidation. That was quite a big unexpected piece of work in a sense, but we're very grateful to local authority partners for helping us to manage this transition and minimise the disruption to patients from that change. And looking ahead, preparations for winter are already underway. Flu vaccinations began this month, starting with young children and school-aged children, pregnant women and frontline health and care staff in the first cohorts. COVID boosters will start to roll out for October for those aged 75 and over, as well as for people who are immunocompromised. And we're also supporting delivery of the vaccine for the respiratory illness known as RSV, which is now available for pregnant women and older adults as well. There'll be most of those will be delivered through general practices and pharmacies, but there'll also be likely to be pop-up clinics in the areas where we see uptake isn't as good, and so we tend to sort of react to that by having pop-up clinics. These are really important to keeping people well over the winter and reducing the pressure on frontline services, so we do encourage everybody who qualifies to have the vaccines if offered. And then finally, we've launched a new campaign to reduce medicines waste in the last few weeks. We estimate that around 20 shipping containers of medicines each year are returned to pharmacies in Bob that unused, or out, because they've gone out of date because they haven't been used, and that's about £10 million a year that's being spent on those just locally. That's obviously bad for the environment as well as for NHS resources, so we're encouraging people to only order what they need from the pharmacy, and if you do have extra medicines, do take them back to be safely disposed of, because some can be recycled now and things and disposed of safely. So that campaign actually attracted a fair bit of media coverage, including on BBC South and so on, so we're running that into the autumn as well. That was my update.
Thank you, Ben. So we've got Stephen.
Mine's a slightly cheeky question because it's on the integrated ICB, the Thames Valley one. And this might seem a bit tangential, so forgive me if it does at least initially seem tangential. Priya Singh came and gave a presentation to the Berkshire Prosperity Board, which is the coming together of all of the leaders of the Berkshire councils, the unitary councils in Berkshire. And it's seen as a stepping stone to the creation of a mayoral strategic authority. And there was a great deal of interest in the Prosperity Board in the footprint of the new ICB, which clearly is not just an amalgamation of the two existing ICBs. There are some subtractions from the Frimley ICB, notably in Surrey and North Hampshire. And I suppose what we were interested in was not just how this would work, but also what its implications might be for the creation of the mayoral strategic authority, whether there was an assumption that this was going to be the boundaries of the mayoral strategic authority, Buckinghamshire, Oxfordshire and Berkshire, or whether that mayoral strategic authority could operate on a different footprint, it wouldn't matter. I don't know whether you have any kind of sense of whether there's meant to be alignment or whether there's room for variation.
Yes, and not in my sort of areas of specialist expertise, I would have thought, but from what I understand, that was one of the reasons that there was such a period of time before this announcement was sort of confirmed, because this was one of the issues I think being discussed in sort of national level. There is actually a caveat in the minister's statement to Parliament that says it is dependent on, you know, what happens with local government and mayoral plans. So I guess they are reserving the right for that to change, and it says it shouldn't really influence that in the statement. So they're obviously thinking of that. But you're right, yes, so the new Thames Valley ICB will be all of Berkshire, but parts of Surrey and that's currently in Frimley and parts of Hampshire populations will move to those respective ICBs as well, yeah.
So effectively what you're saying, Ben, is that rather than this necessarily being a blueprint for the mayoral strategic authority, it may be that the mayoral strategic authority will be the final blueprint for this, and it may mutate a bit. Okay, thank you, that's helpful.
Thank you. Any other questions? Alice, sorry.
Hello, thank you, Chair. Hi, Ben. Could you give us an update about where we are with the Integrated Neighbourhood Partnership in the ICB side and locally, especially Berkshire West?
So are you referring to the neighbourhood health programme there, or to the the place partnership working?
I would turn around and say, what was the update? Because, you know, we went for the national program,
yes,
and yes, and then where are we with that? Because it would be nice for you to give us an update, because we seem to have snippets of information, but it would be nice to understand. But equally, the other question I have is also what is the ICB planning to do about communicating to the public about the new NHS 10-year plan?
Sure. So, yes, sorry, I've understood what you meant now. So there would be two schemes being sort of run in the last few weeks to encourage neighbourhood health development. One's a national scheme that has been run centrally by the Department of Health and Social Care and NHS England. We understand that Buckinghamshire has been selected by the national team for that scheme, but the good news for our local scheme is that there's also a regional accelerator programme, and the Berkshire West scheme has been selected for that one, so that should benefit you know, local residents in this area. So I think that's positive, because it will enable us to sort of progress those bits of work with extra sort of focus and support. I haven't got any more details than that, other than that's just sort of come out in the last week or two. So, but we will communicate that further, and I can bring an update next time on, you know, what that actually means for local neighbourhood development. But yeah, so that's positive in terms of, I think, the local development. In terms of communicating the plan, so at the moment, I think it's fair to say that we've been quite preoccupied with the structural changes, and that just coming out in the last, you know, so well, the 9th of September with the government announcement. But we're also conscious that we do need to progress our sort of planning work going forwards, and so I think that's probably also something I can give an update on next time around the plans for the 10-year plan and the planning process, because all the ICBs are being asked to start to pull together 3-year plans. We were in this sort of annual planning cycle before, and I think there's a recognition that that's too short term, so we've been asked to think about sort of 3 years now. And I think it was literally only in the last week or so again that some, you know, some information has come down from, you know, the national team as to how we take that forward. So I haven't got any specific updates at the moment, but happy to focus on that next time, if that would be helpful.
Thank you, Chair.
Thank you, Ben. Any other questions? Can I, and again, it's a bit of a cheeky one, Ben, but I mean, the ICB is contracting. I mean, two are going, well, 1.5's going into one. Let's put it like that, or something. But and there will be quite a few, I presume, redundancies because of that. Is that something which is destabilising the workforce and things like that? Because obviously it's quite a hard area, and you know, if there's 2 people with the same job, there'll only be 1 and things like that. Is that quite negative?
So yes, it's interesting because we're sort of expanding and contracting at the same time, expanding geographically, but actually with a reduced amount of resource. And there is an expectation that there will be redundancies. We are actually operating a MARS scheme, you know, a mutually agreed resignation scheme is just starting, that ICBs are starting to run. It's definitely having an impact on staff morale. I think, you know, I'd be lying if I said it wasn't. We haven't got to the stage yet of actually having new, you know, organisational structures or roles or anything like that. So at the moment, we haven't got that far, but that will happen over the coming months. And then, yes, we will have to go through those HR processes around identifying the workforce that we need for the new organisation and that we can afford within the reduced funding envelope. So that will be, you know, the next few months, yeah.
Difficult. Yeah, and it's especially difficult when you're expected to be, you know, looking at the 10-year plan and going forward with that, when a negative thing like this is happening almost at the beginning of it.
Yes, that's right. So we've got sort of 3 big priorities, really. There's the 10-year plan, the sort of future planning. There's still keeping an eye on what is happening this year, and because there's financial challenges, but there's also, you know, we've got to keep the quality of services, the access to services, the delivery of, you know, catching up on the waiting lists and so on. And then there's these sort of structural redesign and change at the same time. So we're trying to juggle all 3 of those balls at the same time at the moment.
Thank you. Any other questions? I don't think so. So thank you very, very much, Ben. And so the last thing is the forward programme. I was looking at this, and certainly November looks quite, very busy again. But after November, it trails off. Have we got anything for January and March that we need to put in there at the moment? Or if people do later have ideas and so on, do get in touch with Madeline about them. Nothing else? Okay, well, I'd like to thank you all very